Sometimes you feel so weak and unproductive. Is it infection or diabetes or heart failure or just tiredness? I will tell you how to guess what is the cause of the weakness and how to treat it. Number one cause of short-term weakness worldwide is viral infections. Because most viral infections like common cold, rhinoviruses, adenoviruses don't always cause high fever or important symptoms, but they still activate the immune system. About 80% of healthy adults experience mild weakness and fatigue with viral infections each year. Typical duration is around 3 days, sometimes lasts up to 7 days. Solution in this case is adequate rest, hydration, food containing proteins, vitamin C intake 500 milligrams per day to support immune system cells, zinc intake 25 milligrams daily for 5 days, it may shorten duration, and vitamin D if deficient 2000 international units daily. If weakness is more chronic and is not just tiredness, at this case most common cause is stress and lack of sleep. When you sleep less than 6 hours, the body is unable to restore, cortisol level rises, body burns energy reserves, glucose regulation worsens, and cells cannot use sugar efficiently. In the brain, adenosine builds up and brain has natural sleep pressure at this case, which makes a person feel heavy, tired, and slow. It is more common among young adults, students, office workers, and parents with small children when sleep is fragmented because the baby wakes up 3 to 4 times at night. The solution at this case is to restore normal sleep duration. Aim to sleep at least 7 hours continuous sleep. Reduce blue light before bedtime. Sleeping and waking up at the same time to stabilize cortisol level. Magnesium can help. Magnesium glycinate 400 milligrams before sleep helps relaxation in about 70% of cases, and limit coffee intake after 3 p.m. to prevent sleep disruption. The second most common cause of weakness is dehydration and electrolyte loss. When you lose just 1% of body water, the brain already senses this reduced volume. Blood circulation slows, oxygen delivery drops, and performance immediately falls. At the same time, along the fluid, electrolytes are lost. Most crucial are sodium, potassium, and magnesium. These minerals are responsible for nerve-to-muscle signal transmission. When they drop, signals misfire and muscles cannot contract normally. The brain detects this and person feels dizzy, lightheaded, heavy in muscle, and weak overall. This is most common in athletes and outdoor workers or in summer when the hot climate causes heavy sweating and people lose water and salt together. The solution is adequate fluid intake. Around 2 liters per day plus 1 liter for each 1 hour of sweating. Table salt and soaps for sodium and fluid. Banana, oranges and beans for potassium. And nuts, seeds, and leafy greens for magnesium reserves. The third cause is iron deficiency, even without anemia, because iron is a core element of hemoglobin, the protein which carries oxygen in red blood cells. When iron is low, hemoglobin is reduced, oxygen delivery to tissues drop. It means less oxygen to mitochondria, and the person feels weak. Signs of low hemoglobin are tiredness, dizziness, breathing nails, and hair loss. Low iron is common in young women with heavy menstruation, in pregnant women, and in vegetarians. The best way to check iron is to measure blood ferritin level. If it is less than 30 nanogram per milliliter, it can cause symptoms. If hemoglobin is less than 12 in women and less than 13 in men, it also can cause signs. The solution is intake iron-containing products like Iron from meat, liver, poultry, and fish is well absorbed. But plant iron is less absorbed, but vitamin C improves absorption. Lentils, beans, and spinach are iron-containing plants. From supplements, ferrous sulfate 200 milligrams 1 to 3 times daily is considered effective. About in 80% of cases, it restores hemoglobin within 6 to 8 weeks. The first most common cause of weakness is diabetes and blood sugar fluctuations. Because glucose is the main fuel for our body, both low sugar and high sugar damage energy supply to cells. In insulin resistance cases, despite high sugar level in the blood, it does not reach enough to muscles and brain, and the person feels weak. And in low blood glucose cases, there is not enough glucose and person still feels weak. This is among people with undiagnosed or untreated diabetes, in pre-diabetic and obese persons. When blood glucose spikes, then due to high insulin, it crashes and person feels heavy and weak. Fasting glucose should be less than 100 mg per deciliter, and glycated hemoglobin should be less than 6.5 to consider without glucose problem. The fifth most common cause is thyroid problems. Both thyroid hyperactivity and underactive thyroid gland cause weakness. In hypothyroidism, when there is low thyroid hormones, metabolism slows, muscle gets less stimulation, and person feels weak. In hyperthyroidism, there is too much hormones, metabolism is overactive, muscles break down easily, the heart works too fast, and weakness comes from exhaustion. To check thyroid problems, the best test is TSH, thyroid stimulating hormone. High TSH means hypothyroidism and low TSH means hyperthyroidism. The sixth relatively common but serious cause of weakness is heart failure. It is especially common in older adults after 60. When the heart is unable to send enough oxygen-rich blood to the muscles and brain, the person feels exhaustion after every activity, even walking across the room. It is common in elderly patients with long-standing hypertension, develop gradual fatigue, swollen legs, and shortness of breath. Also common in post-heart attack patients, the damaged heart muscle cannot pump fully. Weak and tiredness are constant in this case, and older adults with valve disease complain of fatigue, especially when lying flat or walking, relieved somewhat by sitting or resting with legs up. The seventh common cause of weakness is cancer-related fatigue. This is among the most serious cause of persistent weakness because cancer cells consume energy rapidly, release inflammatory chemicals, and often cause anemia by invading bone marrow or through bleeding. The body is constantly fighting, so even if a person eats and rests, the weakness does not improve. Common scenarios are middle-aged men with colon cancer, complaints of fatigue, pale skin, weight loss, and blood in stool. Women with breast cancer, even before diagnosis, feels constant tiredness, night sweats, and unexplained weakness. And patients on chemotherapy develop severe fatigue from both cancer and the treatment due to bone marrow suppression and anemia.